Yet behind its simplicity lies a quiet struggle lived every day. For the marginalized people, seeking healthcare still means traveling long distances, waiting for hours, and carrying the heavy burden of uncertainty. But this is not where the story ends. Over time, a new hope has emerged. Healthcare is no longer something far-fetched. It is reaching the doorsteps of rural communities, bringing healthcare closer to those who need it the most. This transformation has a name, Gramin Kollam. Nobel Peace Prize laureate Professor Muhammad Yunus began his work in the 1970s. Driven by a vision to transform the lives of the underserved, he had introduced microcredit, a new language of change. His belief was both simple and profound. Development cannot be measured by economic statistics alone. To create a lasting change, it must impact the whole part of people's lives. No effort to eradicate poverty can ever be complete while healthcare remained beyond the reach of those who need it the most. It was this realization that inspired Professor Muhammad Yunus to create affordable healthcare opportunities for the underserved communities. Under the Rural Health Program, primary healthcare services were first introduced through a pilot initiative in 8 health centers. Then, in 1996, Gramin Kollam was established, a non-profit organization founded on a commitment to stand beside people. Its mission was clear: to narrow the healthcare division between rural and urban communities and ensure quality healthcare for all. Today, that mission proudly reaches 6,045 villages through a network of over 155 health centers across 40 districts of Bangladesh. Every year, more than 750,000 people receive direct healthcare services through this growing network. Supporting this effort are over 76 MBBS doctors, more than 200 DMF practitioners, over 50 paramedics, more than 155 skilled laboratory technologists, and hundreds of dedicated health workers. From primary care to specialized services, Gramin Kollam offers doctor consultations, diagnostic services, video consultation, maternal and child health care, immunization, ultrasonography, eye care, ENT treatment, diabetes management, pharmacy service, and cervical cancer screening. Its modern laboratories provide access to 35 types of pathology tests and 29 types of hormone tests. Each year, nearly 500,000 pathology tests and 130,000 ultrasonograms are performed through Gramin Kollam facilities. More than 25,000 people receive immunization services annually. Through micro health insurance cards, over 100,000 people are able to access healthcare at affordable cost. In addition, nearly 200,000 school children benefit from free health checkups every year. Today, healthcare is no longer a distant aspiration. It is steadily becoming a citizen's right. Each year, around 750,000 people receive direct healthcare services, while health awareness messages reach nearly 7.8 million people across Bangladesh. With the goal of building a healthier and more equitable Bangladesh, Gramin Kollam is advancing its Vision 2030 agenda. The plan is to establish 300 modern primary healthcare centers will evolve into an advanced 10-bed healthcare facility, providing enhanced laboratory services alongside cataract surgery and normal delivery care. To further strengthen access to quality healthcare, modern 150 to 250 bed hospitals are being developed in Ghazipur and Tangail. alongside a modern nursing college in Anwara, Chattogram. At the same time, innovative healthcare solutions are taking root. In selected rural communities, HPV DNA-based cervical cancer screening programs have already begun. Through this research-based pilot initiative, 20,000 HPV testing kits are being used to provide underserved women with access to life-saving screening and essential referral services. Plans are underway to establish a nursing college, a medical college, and a pharmaceutical company. At present, Grameen Kollam is more than just an organization. It is the realization of a dream. Guided by the 7 principles of social business and Professor Mohammed Yunus's vision of the 3 zeros, zero poverty, zero unemployment, and zero net carbon emissions, Grameen Kollam continues its journey toward a more sustainable and equitable future. Grameen Kollam in healthcare right by your side.
Hello, welcome back from your lunch. I hope we're all a little bit energized. I see a lot of people are still coming back. Thank you so much. All right, awesome. Next, we have an amazing plenary up ready for you with a stellar lineup. I'm super excited to introduce the speakers. First, we have the moderator, Mr. Richard St. Pierre, Senior Digital Sovereignty Advisor, Livio. Can we have a round of applause, please? From our speakers, we have Ms. Lacey Hubert, President and CEO, Electa Foundation. Could we have a round of applause, please? Next, I'd like to welcome on stage Mr. Shamsul Haq Ahmed, Managing Director, Grameen Healthcare Services Limited, Bangladesh. Could we have a round of applause, please? Next, I'd like to call on stage Dr. Ahmed Arman Siddiqui, CEO and board member of Grameen Health Tech Limited and acting CEO, Shamathan Services Limited, Bangladesh. Could we have a round of applause, please? Next, I'd like to call on stage Mr. AKM Moinuddin Chaudhry, Managing Director of Grameen Kollam, Bangladesh. Could we have a round of applause? Next, I'd like to welcome on stage Mr. Joseph Hazel, Group Chief CEO, Apex Health. Could we have a round of applause? And last but not the least, Ms. Kate Moynihan, Executive Director and CEO, Seva Foundation. Could we have a round of applause? Take it away, Richard. It's all yours.
Hello, and we have to welcome Kate, who flies from very far away. I'll introduce her more formally just after. Hello, everyone. It's a pleasure to be with you again. We have quite a group, some from Grameen, others from a bit further away. For myself, I come from Canada, so it's not snowing these days, so I appreciate the weather outside. But I also I'm very proud of our Prime Minister, Mark Carney, because he delivered his Davos speech and he was talking about fracture, and it really resonated the world over, and I'm sure it resonated here as well. I had the pleasure of speaking or sharing the stage with 6 illustrious people. I will introduce them as we go, but after discussing with them, I encourage you to see how they approach things in a way that impacts people. So this is not research and development, producing paper, producing strategy. It's about producing impact. And all those people, I was a bit surprised of the commonality of what they were saying and how they were approaching it. They really wanted to deliver care to people, even in rural area, and accessibility was very high on the list of things that they would do. Having worked in other healthcare sectors in Canada and France, namely, I can tell you that this is not typical. It was a surprise for me and a good one for the future of what we're trying to do. The question today is about the role of technology in the context of healthcare and accessible healthcare to all. Of course, technology is pervasive in healthcare, and with the rise of AI, it's even more. But the core question is about accessibility, way more than the technology. The technology is an enabler. How you make it accessible to everyone is the key thing. But coming from a technology background, I would argue that in the past, or the 20th century, I should say, was wealth inequality was central to how things, you had healthcare if you had money, no healthcare. What we're discussing today helps alleviate that. The same thing is starting to happen with technology. If you have AI, for example, you might have better healthcare. If you don't have AI, you might have less healthcare. So that question of money in the 21st century translates to healthcare as well. And I might add, I was a bit surprised. My wife sent me an email last night. The US administration last night requested from Silicon Valley, the people who have the big AI models, that they would restrict access to those AI models only to US citizens. Think of what I just said. If you're in a hospital, you're a doctor, and you are US citizens, you can use that AI system. If you're not a US citizen and you're the same doctor in that same hospital, you cannot use it. So this question is not technology. It's really democracy in what we're doing. So technology has many pervasive things. So today, healthcare accessible to all. So we'll start the question with Dr. Ahmed Aman Siddiqui. So you're the CEO of Grumman Healthcare. That's quite impressive already. And you're also the CEO of Shavanan Service GPay. You've been 20 years in that kind of business environment, and you've received so many awards. I was looking at your website yesterday. I won't list all of them because it's a long list, almost as long as the ones from Professor Yunus. So your model is about digital first primary care delivered through the phone. So can you explain how the accessible healthcare to all using technology and social business at Suki?
Thank you so much, Richard. It's been an honor to be here. I'm also super happy to come and give my 2 cents about the health tech. So, Richard, Suki is the brand of Grameen Health Tech, and we are the new feather in the flock of Grameen Group. So, I'm actually the junior most people among these 2 gentlemen. So, I'm from Chittagong. We call this Bodda. So, these are my Bodda. They are actually my senior brothers. 2024, 14th of February, on the Valentine's Day, I joined with Grameen Group. And then I had a direct contact and direct discussion from the chief that you just mentioned, Professor Yunus. So his vision was very simple. He said, like, the way Grameen Phone, another best milestone of Grameen Group. We are, I think, the #1 MNC of the country. Like Grameen Phone, I want healthcare or health service on everyone's fingertips. Then what we started doing and investing is the technology. So you will be happy to know that Suki is actually an inbuilt app developed by the in-house team. We have our 26 people DevOps team who actually delivered the app within 7 months of sprint. So we went through a Kanban sprint. So fast forward, in November 28th, 2024, we had the commercial launch, and we had a great declaration in Manila. I don't know how many of you from 2024 Manila, can I see some hands? Yay, I can see the Negros friends. Thank you so much. So you will have a great surprise tomorrow. Hang in there till the evening. Sarah will say something about that thing. So we had this commercial launch in 2024 November. So first we had the app where anyone has a Play Store and App Store can download the app and get the doctor. When can they get the doctor? The SLA was 15 minutes. We ensured anyone can see a doctor in 5 minutes. And by the way, we are in a country where 36% of the population die without seeing a proper MBBS doctor. We have only one doctor for every 20,000 populations. We have half nurse, not even 1.5 nurse per 20,000 people. But we have some blessings. We have a lot of doctors. They want to flock around Dhaka city. They don't want to go to the rural area. So we had a humongous pool of doctors, and we ensured that patients are served within a span of 4 minutes. That was the basics. Then comes into the picture, what happens to the people who doesn't afford a smartphone. There we had the IVR. You dial 10657, and anyone can hook with a doctor and talk with the doctor. Then Professor Yunus, you know him, he pushes us really bad. He said, what happens to a person who is a farmer, who have used insecticides, have a skin disease? He cannot see a doctor without showing the skin disease. So he needs a video. That's why we came out with a unique concept. We call it Shukhi Sheba Kendro. So all the pharmacies, local pharmacies in Bangladesh who has got the legitimate pharmacy license, we tied up with them. And we put up a signboard, we gave him another assisted app. And through that, anyone can, and everyone can actually step in and get into the service, and they can get the, the doctor consultation and everything. So that's the beauty of it. So now let me discuss about the social business perspective. So I asked my boss, our group chairman, Mr. Ashraf, that, okay, there is no business case. If we roll it out to 9,850, then he said, it doesn't matter. We want to go to the deepest rural, and we want to go to the bottom of the pyramid. That's the beauty of it. And I think the best part is Shukhi successfully penetrated 3.5 million bottom of the pyramid. I'm again saying 3.5 million bottom of the pyramid customers, and they're getting services within a span of 5 minutes. They can see a doctor immediately. And even if they passed away, they have an insurance of 50,000 taka. Last feather on the flock, Richard, then I will be finished here. Last feather on the flock is we recently launched Shukhi Village, which is, we call the link workers. So we took care of the urban, we took care of the semi-urban. So with the rural, there are link workers who are actually going to the doorstep of the villagers, and they are actually having the complete EMR of the patients. And we had this pilot, and you will be happy to know, out of this pilot, 100% pregnant women delivered normal. They had a normal delivery. So that's a huge milestone that we have done.
I think, I don't know, the people in the audience, if you realize the numbers that we've just shared are very enviable, even in the G7 countries. I know, again, coming from Canada, these numbers are unheard of in my country. So congratulations to what you've done. Thank you.
Thank you.
Our next guest is Shamul Haki Ahmed. He's the director of Gramin Healthcare Service and Science Institute and Research Center. You run an eye hospital, right?
Yep.
And you also are building a tertiary hospital, and you have 25 years in corporate operation and business development. And I may say to the audience, that's the other commonality of all of them. They have a background in a variety of industries. So I guess this background helped you in creating novel and creative approach to the healthcare sector. So maybe first question for you, how do you increase accessibility to healthcare in rural areas especially?
Yeah. Thank you so much, Richard, and dear audience. So if we talk about the business strategy of Gramin Healthcare Services, the first and foremost thing we are strategize the thing is reaching to the unreachables. So this is how we approach the eye care as we run with the help of the social business model. So while doing so, reaching to the unreachables, we came up with two impediments which played a very big role while we are trying to access into the deeper into the locality. The first one is like that. When it comes to people's mindset, we see that they have got little healthcare, limited healthcare knowledge, which acts as a impediment. And second is, there is a common syndrome which is seen across the urban, in the rural area of Bangladesh, is like late healthcare seeking syndrome. So they wait until the final thing happening, getting into more severe stage, and only they move to for the healthcare consultations. So keeping this thing in mind, we had developed few strategies to go deeper into the locality. And we used to use basically 4 to 5 key elements. And the most importantly, what we do, we keep innovating. Because in course of experience, we come up with different type of reactions, different kind of behaviors from the patient part. So the first thing we do is we used to have a hub and spoke and hub model into our whole business structure. By saying hub and spoke model is, we have got secondary hospitals across the country, which is 5 in number now. And within the periphery of 40 to 50 kilometers, we used to have the primary eye care centers. So this helps us to go deeper into the thing. So it works well with us. The second thing we used to have, we go further distant by having outreach camps across the catchment areas of our hospital. So which also helps us to go more deeper. So we used to have at least 60 to 70 camps in a month, and which each of these camps which covers almost 200 people. So which is a big number in of the day. The third one we used to have that we used to run few clustered programs. So what we do, instead of they coming to us, we go to the schools, we do the school site testing programs, we go to the industries, we do the industrial site testing programs, and we target the different communities of our country, and we approach them with the same kind of thing. So this also we find to be very effective in terms of penetrating the, the locality. And the last thing, the other point you use is the digital medical record system. We call it EMR, electronic medical record. So the best part of this system is like, once you get yourself registered into the thing, way forward, onward, you do not need to be physically present in the hospital itself. So by using this EMR, you can log on to the system and you can get your telemedicine, teleophthalmic, and any kind of ophthalmic, suggestions, consultations through this. So far we used to have these 4 key elements, and our experience says, 2 decades of experience of Grameen Healthcare, we see that these are working well. But again, I say that we still keep innovating. The last addition into the whole part is using of the portable devices. So again, as I said, that to get rid of that syndrome, what they're demonstrating in their behavior and in their attitude. So we used to take the help of the portable devices. We used to do door-to-door campaign. We go to each houses, we do the preliminary test. And from there on, we also increase our fold of the patients' footfalls, and we go deeper and deeper. So these are the things we are following to increase our accessibility on behalf of our eye care services. Thank you.
Thank you, Shamul. A good round of applause for his work. Now we have a duo, and I was impressed by the collaboration of these 2 groups. So from Bangladesh to China, US, Africa. I'll introduce Mohamed Saroudi, the Managing Director of Grameen KLN, and he is heading an organization that is quite incredible because 650 health workers, 750,000 of patients a year that you have, and he has a partnership with Lucy Hubbard that comes from the US, founding president and CEO of Electra Foundation, one of the largest cervical cancer screening program in Africa, and they're working collectively, serving about 500,000 women a year. So it started where? Maybe starting with you, and then explain the relationship that you had as it expanded. Yes.
No, it's not on. Am I audible? Oh, I am. Thank you so much, Richard. I'm Mohan Chaudhary. As I said, that Grameen Kalyan, you have seen the audiovisual just a few minutes back. So I will not go into that details, but what I would say is we have 155 health centers across 40 districts in 6,000 villages. And there are two challenges that we must know. The poor people don't have access to the doctors, number one challenge. But we have made sure that we have recruited 76 doctors that you've seen. They're MBBS, and they are taking care of almost 750,000 patients in our health centers, and 7.8 million people are coming into the coverage of entire Gramin Kollan's network. Number two is we have revolutionized our diagnostic services, because poor people don't have access to the proper diagnostic services. Now, what we have done is we have 155 diagnostic centers. There, 100 of them are totally transformed into advanced diagnostic center by doing the hormone tests, which we didn't have. And the next revolution we had is Gramin Kollan is the only company in the private sector in Bangladesh who has established a molecular lab in the rural areas. There comes Lacey. Lacey Hubbard is my partner from Electa Foundation, and she has helped us how to do this. So I don't want to waste much of time on this, but I would be really happy to hear from Lacey on this. Lacey.
Thank you, Moy. You are the best. So before I tell you, I want to tell you a little bit about who Electa Foundation is and why we are handling cervical cancer. So for those who are not familiar with our foundation, we are a Swedish NGO dedicated to improving access to underserved countries, because we believe where you live should not determine how long or how well you live. So our focus has been on cervical cancer screening and prevention. More talk about this, and you'll wonder, why cervical cancer? Well, cervical cancer is highly preventable. In fact, it is a very few cancers that can potentially be eliminated, because we know the cause. It is HPV infection, and we have the tools, vaccination to prevent it, and screening to detect pre-cancer, and you can treat it early. But still, every 2 minutes, a woman dies to this disease. And if you Google it, if you go to the World Cervical Cancer Map, you can tell the high-income countries, women less likely die from cervical cancer. Then you go to middle-income countries, and then you go to low-income countries. The woman is just gonna be you wanna see the dark red, and a lot of deaths according to that. So you look in Bangladesh, cervical cancer remains the second most common cancer in the country. So when it comes to cervical cancer screening, and we are talking about highly treatable, is we already know a lot of technologies. We know, for example, HPV DNA test, right? But that test is not able, most countries not able to adopt it because it's a high cost. So now we talk about accessibilities, right? And accessibility to me, it's now about technologies. Accessibility is how you can implement it and deliver the scale. So when we're working with Moise Grameen's, the Grameen health centers just set up excellent, because women can go there, get HPV testing. If they have a pre-cancer, they go back, and then now it's also being treated on the spot. And that is wonderful, because now you look at women, only women with suspected cancer, they need to travel to hospitals. Majority of women, they can just get treated close to their home. And isn't that wonderful, right? And then also from our experience, we see is when you have those new technologies coming out to scale, you have to have a trust, because people need to understand and trust them in order to use them. Otherwise, they are not gonna do it. And that's why in Africa, we're using community health workers to educate them. But Grameen's health, they already trusted them. So when they say they should do it, and these women lined up, I was just told today, so many women want to get HPV tested, they are just like, okay, slow down a little bit, right? And that's a wonderful, it's a wonderful issue. But I see we can do so much better in this area. And the third is, what I see is affordability. And Richard, you talk about it. If You can have the best technology in the world, but if no country can afford to implement it, oh well, how are you going to scale it? So using HPV testing example, when I say it's very new in Bangladesh, it is not because the healthcare leader don't understand the benefits, because the cost is so high. That's why they shy away. They try to find the less cost-effective alternatives. But why vulnerable communities should just have less technologies, right? So that's why at the foundation, we're working really, really hard with global leaders and the global experts, with the manufacturing. So our goal is to bring the HPV cost down to reasonable price while maintain high quality and high throughput. And with Moy, we're working together. I see we're doing 20,000 as a pilot project, but this is just gonna be just very first step. I can just see this gonna shine, just gonna take off.
And maybe, Lacey, a follow-up question, if I may ask. Just a follow-up question. How do you see this expanding throughout the world? You talked about pockets and depending on the affordability standpoint. How do you see, if you look 5 years, 10 years, how does that expand from where it stands today?
Richard, 5 to 10 years. By then, we will eliminate cervical cancer. Think about it. World Health Organization has made a global call to eliminate cervical cancer by 2030. That means 90% of younger girls are vaccinated, 70% adult women are screened, and 90% from screening, you discover pre-cancer and the cancer they are treated, right? So I sure hope in Bangladesh by then, it's already done. I can see 3 years. You should have just finished it. In 5, 10 years, I think after cervical cancer, you're talking about the breast cancer, you talk about men's prostate cancer. I think the technology is coming up every day. And if we're doing smartly, by then, cancer should not mean death to anyone. That's what I see.
Excellent. I wish that that happens. All right, now we're going to move to the Middle East with Joseph Hazel. He's the CEO of Apex Health. You run a very significant 4-country hospitals, close to 3,000 beds, mostly in the Middle East region. Maybe present what you are actually doing and how do you use innovation to sustain that breadth and scale of activities.
Thank you very much indeed, Richard. And it's an honor to be here from Qatar. It's very similar weather I can feel outside as well. And congratulations on the anniversaries, both the 50 years and the 20 years. So, Professor Yunus, amazing. I think from Apex Health, just to introduce us, that we operate 8 hospitals currently in 4 different countries. We have another 30 in the train over the next few years that we'll be leading. We're a builder and operator of hospitals. We are a private organization on the Qatar public market. So we have 5,000 Qatari shareholders who are pushing us to drive excellence out from the Middle East, but using our international partners from the US, from Europe, and also from Asia as well. So our particular, the challenges and the things of what we've been doing with innovation is really about empowering the patient. The key thing for us is we find that we talked earlier about collaboration and trust. Unfortunately, since COVID, I think people have lost that collaboration spirit. Everyone's gone isolationist. I know one of the themes here is about how do we bring back together this fractured world. Unfortunately, most countries are segregating again. The regulators are pulling apart. They're doing their own things. Every country you go to has its own healthcare way of delivering. What we're doing is really trying to bring that standardization. We're bringing technology to empower the patient, like was mentioned earlier about the apps, making sure that the technology and the capability is actually in the patient's hands. So they have the information, they have the ability to choose and follow their destiny. But the key thing is also educating the patient so they can decide and have that trust and make their right choices. So that's the first element for us, what we're doing and delivering. But surprising enough, what you think is standard, good quality healthcare is not very standard and not very common. You tend to find in a lot of countries, unfortunately, the basic standards are not there. So like what is happening with Green about training the workforce, you don't have that standardization in a lot of countries. You don't have that capabilities. There needs to be more of it. So part of our role is helping bring that quality of standards and that training, that ability from all the international partners to make sure there is that availability of standardized proper healthcare and to build that trust.
Can you maybe, because you run the actual operations, what type of technology are either you're using right now or you will be using that will have the most impact in the future that you can feed? Is it AI and X-rays, or it's more like how you manage digital records? What's the span here?
So I think you do have to have a backbone, which is your electronic medical record of every hospital. We are a hospital provider. You have to have a very strong backbone that allows you to link everything else on top of it. There's a lot of embedded with systems, with the AI, with the capabilities. But the way it's moving nicely now is away from what was just digitalization of things. So therefore, you're simply moving things from paper onto computers. What's nice now is that doctors are beginning to have support, clinical decision support. They're being able to have not just from their own individual learnings, it's also about the support and capabilities from the best practices from around the world. So they can bring that to bear. There's lovely things with AI now that you can do this ambient listening. So as there's a communication conversation between doctor and patient, it's already filling up your medical record. It's already placing orders for the next steps. It's already booking things and certain things for you. So there's lots of things which are coming, which are in that sort of development phase. And over the next few years, it's moving so fast that, again, it's coming back to clinical decision support, operational efficiencies, supply chain improvements, but most of all, to me, it's the patient empowerment. They having choice, them being part of that journey, rather than in most countries in the world, the public health systems, it's about managing a population, and they treat everybody the same. The way it's moving now is every individual patient will have their personalized journey, and they can decide on their lifestyle choices, their elements of what they wish to do. They can see the impacts of what's going to happen. So therefore, it can become more preventative care side. We can be less reactive and simply be treating people on the way it's coming in. But we can actually be more of the mother hen. So every patient has its own personal doctor, personal nurse. It doesn't have to be physical. It can be virtual. But that supporting care allows everybody to have its own plan. And that's the way it's moving at the moment, very rapidly. And it's also allowing us to integrate care. Like we have with Green Health, they have the primary health care, they have the telemedicine, they're now building hospitals. That integrated care, that connected care, at the moment, most places around the world is very fragmented. Even in the US, dare I say it. So it's, where you think there should be the best quality of healthcare. It's really allowing that integrated care, that journey for the patient, but allowing the patient to have choice. The better you educate that patient, then the better they can choose, and they can choose where they go, how they do things, and just empowers them, which is the key thing for us.
Thank you, Joseph. Yeah, round of applause for Joseph as well. So last but not least, Kate Moynihan, she's the CEO of the SEVA Foundation. I encourage you to go and see the website to see what SEVA does. It was quite impressive. And one line on our exchange struck me. She says that she's a catalyst for institutional and system change. So for me, if there's something we need, is a catalyst for system change. So Kate, can you explain a bit your mission and system change? How do we do this?
Thank you, Richard. And I also want to extend our sincere congratulations on this epic event, the 50 years, the 20 years from the Nobel Prize. So SEVA, the word is a Sanskrit word, and it means selfless service. And Dr. Farron just taught me it would be close to Nish Sharato Sheba. Was that close enough? Did I do okay? All right, rock on. We're an organization that has very similar, a lot of the morning session was very familiar to me. I felt like I was back home. My organization also started in the late 70s, early 80s. There was a weird group of people. There was a scientist who helped eradicate smallpox. There was a spiritual leader from the United States who got a lot of wisdom from his time in India. There was a clown who who monitored the, the Woodstock concert. So we had a very eclectic beginning. But from that came a real love and curiosity about how to further humanity and what could they do together. So they had come off of this high of eradicating smallpox, and they wanted to understand what's the next big health issue that we could take on. And this is where your friends from Nepal with their 1,000,000 clubs come in. We did one of the most comprehensive epidemiological studies in Nepal. It was in consultation with the WHO, and it was funded by the Netherlands. And what we found through that and that's a very big body of work that's still referenced today. What's interesting about that is that it really launched an entire industry around sight, because what they came to conclude was that the principal threat to people's dignity in Nepal was a health issue that was actually something that we could treat. The technology exists and it could be affordable, and it's about correcting sight in terms of things like the glasses that we're all wearing. These are 700-year-old technologies, to cataract surgeries. And what we've done over the past 50 years is perfect the ability to deliver world-class cataract surgeries and a range of services for what we call treatable blindness. And if you were to look out at this room, what that means is it's 1 billion people are living in unnecessary blindness. It might be because they didn't get a pair of glasses. It might be because they have a cataract that hasn't been removed, glaucoma that hasn't been treated, on and on and on. That's the front of the eye. And so what's interesting is now we've got it down to a science where worldwide we can do cataract surgeries in 15 minutes and it costs $50. That's a forever gift for someone who might not have been able to see their things. That's my staff that's clapping. Thank you, Kuldeep. So let me hit you with a couple of numbers because I find them pretty fascinating. And I think what's so inspiring about this morning's session and why we're very honored and grateful to be a part of the partnership with Grameen Health is that I think that SEVA has a social business model. Its directive is to make sure that the most marginalized people in the most marginalized communities have access to the world-class healthcare. And it doesn't come at it with a colonial or even a paternalistic approach. It really sits down and listens to the local wisdom. So while there's an undercurrent of the science of what we do that happens in every country that we work in, because you want somebody who's operating on your eye to know the science, but there's also a lot of creativity and innovation for how it's executed in countries. So let me walk you through some of the numbers that get me up in the morning. You heard earlier what keeps people up at night, so let me tell you what gets me up in the morning. $1 trillion. We've done SEVA's research that's been published in WHO Bulletin and elsewhere proves that by not addressing vision loss, low and middle income countries are losing over $1 trillion a year. That's Warren Buffett's Berkshire Hathaway portfolio. We know that for every $1 you invest in eye care, you get $36 back in social and economic benefits to the community. That's a best buy in health, absolutely. We also know that if you get a kid a pair of glasses when they're young and at the right time for their learning trajectory, they will learn 78% more than their peers who didn't get those pair of glasses. So we value people over profits. We try and come at it with a sense of joy. We take the work seriously, but we don't take ourselves very seriously. And we really have a deep commitment, almost a fearless commitment to the love of humanity, the fact that we want to unlock the excellence and be part of a community solution. And during COVID, just as an aside, there were a bunch of people with a different model where they have to fly in. I think somebody in the earlier session today talked about flying in and doing the work and then leaving. We don't subscribe to that. We think inequity solutions have to be built to last in the local community from the local talent. And during COVID, our work didn't stop because nobody from North America or Europe had to go anywhere to do the services. That was all homegrown and the people were able to do the services for themselves.
Thank you very much for this. I told you I would ask you a trick question. So here's a simple one. So if you had a magic wand, what would come next for you?
Oh my God. All right. This is my 5-year-old Kate is excited about this question. Well, I think it would be the gift of sight. But what I mean by that is not only in the technical term. This is a health issue that money can solve. Nobody needs to be blind. So I think there has to be that aspect of the wish or the magic wand. But I also think it would be the gift of sight to sort of realize what Professor Yunus and the Grameen team is really trying to say is the gift of seeing a world differently and being brave enough to take action to make some of the changes that we can maybe grow, kind of have a different world ahead of ourselves. So the insight to believe in yourself and one another in a different way of imagining.
Thank you. As we're coming to a close, I'm going to ask a single question, but 60-second answer. So very short to all of you, right? We're going to start with, let's say, Armand. And Armand, the question is simple. We meet again in 10 years. What will have changed? What will you have built? And what's the new reality here?
Why I have to be the first to answer every name? Anyways.
Because you're my friend and we're sitting beside each other.
Okay. We have solved, the difference between me and the rest of the people here is I am only in digital. So for the digital health tech, the issue is the doctor cannot touch or feel before they're treating the patients, which we have solved with one of the device. 10 years from now, I would love to have the VR, the doctor can actually measure and they can feel the pulse by himself or herself. They can measure the fever, they can measure the CO2 and everything in 10 years from now, so that we solve issues that we have currently for the healthcare in Bangladesh.
Good, thank you. Lacey, you want to go next? Yes. I'm changing the order here.
Sure. Same question.
Same question.
Say it again. What's the question again?
So same question for everyone. So we meet in 10 years. What will have changed?
What have to be changed?
What will have changed? We're in 10 years' time. So in your case, most probably that cervical cancer has been eliminated, as you were saying.
Right. So what will change? What I see is it should be more shifted to prevention from the treatment, because prevention is so much more effective, so cost efficient, and so much the woman male or woman, right? This case, all have a much better chance to live in a quality life.
Good. You want to go next, Muhyiddin?
Well, it might sound a bit different, but I will revolutionize and change the entire systems of primary healthcare. Because what we get, we don't get anything. What I would do is having 300 health centers across the country, 20 hospitals where I'll take the poor people up to the hospital, let them not come to the hospital. And also, I would like to make sure that in Bangladesh, there'll be no cervical cancer, along with Lacey, and a bigger platform. Thank you.
Excellent. Joseph, you want to go?
I want to say that. I think with Moed, it's not 300. It's going to be 30,000. We're talking about 10 years, right? You're going to have
I'm talking about health centers.
Yeah, you're going to have
30,000, or then I'll be the most happiest man in the world.
So it's okay. We're clear in 10 years what we're going to get. Thank you.
I'm not entering this competition. I think for me, the key thing is actually at a slightly higher level. I hope that there's a bit of a wish and a prayer in the next 10 years that the countries will start collaborating again to improve healthcare for everybody across the board. I think they're lost that space. I think our job is to help them reconnect. And the connected care with technology is to really make sure that journey, so whether you can treat people in primary care rather than come to hospitals, there's so much more that can be done at the preventive stage. But for me, the real challenge, as I mentioned earlier, is really about the patient empowerment, which comes with patient education, giving them the tools, giving them the support, building that trust so they can take that journey themselves, that they have their own documentation, they have their own pathway, and therefore they can follow that connected care and have real trust in the system that we're delivering. It's that ownership and trust that really makes them own their own healthcare, and they should be able to see with that, like we've always been promised with this metaverse, you can see what if you don't choose this path, what your outcomes will be. So they can choose and select what they wish to do. That's my key.
Thank you for that. And we'll have the famous last word from Shamshul.
Yeah, thank you. For me, as I'm representing Grameen Healthcare Services, my answer is very plain and simple. 10 years from now, I want to see Grameen Healthcare as the largest eye care chain social business entity in Bangladesh. This is one thing I want to say. Second is like that, this Grameen Healthcare will be highly leveraging on technology. We know for technology adoption, it costs you, initial cost is very high, but in the long run, it helps you to achieve two very critical aspects. One is the operational efficiency, which is very important once you opt for that sustainability, self-sustainability, and it also increases the patient satisfaction to a good extent. And third thing I want to see that we should drastically reduce on behalf of Grameen Healthcare Service the percent of medical tourism in I segment. So that should be drastically reduced by having the Grameen Healthcare entities across the nation. So, and last but not the least is, now we are operating in two-tier business model. We are in the primary and in the secondary, but of course we want to see our presence in all the components of the whole eye care chain. So I'm in the tertiary, secondary, and the primary. Thank you.
I see, you can see that you can be very, very proud of what you've built there. You cannot envy any other country. You have health that is being delivered and that touches a lot of people, way more than a lot of countries. You have the recipe. Carry on. Thank you, and a good round of applause to our group.
We want to give a good, let's give a big hand for Richard also.
Okay. Thank you.
Requesting all speakers to stay for a group photo. A group photo.